Alright, you're live.
Hey guys, it's Dr. Emer and West Hollywood Cosmetic Dermatologist, and you guys know we specialize a lot in acne scarring. And one of my patients here is starting to notice just a little more irregular texture, so we're going to use some Bellafill, which I've talked to you guys about numerous times. Actually, very few doctors use this in the United States. I don't really know why. I think it's because they're just nervous that this is a more long-term filler. But the reason I like it is because it is a long-term filler, and actually when used properly, in small amounts in the skin, it actually can build a lot of collagen. So we're gonna do a couple things for her. We're gonna inject some of the filler for the deeper scars, and then I'm gonna use a chemical called TCA for actual improving some of the ice pick scars. So turn a little to, yeah. You can see here there's a little bit of an irregular texture throughout here. And my very pretty girls always notice it when they're taking pictures or they're in an elevator and there's an overhead light, or they use a selfie light, there's something, a side light or something. So that's why we have our bright light here today, because I can really then see where all these individual divots are. And I'm literally going right underneath them and just doing a small amount of the filler. And what that will do is it'll improve it immediately, then it'll kind of go down. And then over the course of the next 6 to 12 weeks, it will build. Now, it actually has been shown to build up to 5 years. So you don't want to overdo it, because that could then cause a lump or a bump. But if you do very small amounts, it'll build. And then in a month or two, we'll do some lasers on her, which will then build the superficial texture, improve the superficial texture. And then that's the overall combination that we want to see. You can see here when I stretch the skin, it almost goes away. So what that means is a little bit of filler and some lasering will really make a huge difference for her. So once she's back from the south of France and Italy or wherever else she's going to be, we will start the laser process, because you don't want to do lasers when you're in the sun. One thing that can help when you're in the sun but you still want improvement would be to do micro rolling at home. So you can use a dermal roller every week, kind of build collagen through those scars. The thing is though, when you lose weight, like if you're very fit like her and you lose some weight and get contoured, you can lose some volume in the face too. So that's why scars can sometimes become more prominent as we age in general. And she works out a lot. She looks so hot. You're welcome. So that actually made a huge improvement, see, already? So you guys are going right under the scar, very superficially, micro-aliquot dosing. It's a lot of little pokes, but the results are better, and that's why it's important to go somebody that knows how to inject this, because you don't want to lump or bump. Okay, turn back. Smell as big as you can. So I want to look when she's in movement, good, relax, because that helps me determine where some of the best places to place the filler are, because if you improve with movement your scars, it means volume's needed. Alright, you guys, so that's the first part using Bellafill for acne scars. I'm going to lay you back so I can shine a different light on you for the TCA.